Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, here is a rather startling statistic. 1 in 5 Americans lives with a mental health condition. Now, that's according to the National Alliance on Mental Illness. Of course, mental illness does refer to a whole range of mental health conditions, disorders that affect your mood, your thinking, your behavior, and there are a lot of different maladies that can affect your mind, unfortunately.
Examples of mental illness include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors. Here to discuss mental illness and the challenges facing us today is Mayo Clinic Psychiatrist Dr. Teresa Rummans. Welcome back to the program, Dr. Rummans.
Thank you.
Dr. Rummans, nice to see you because I know you spend part of your time down in Jacksonville.
Correct.
The winters in Jacksonville, summers in Rochester, is that how it works?
Wouldn't that be nice? It's every month, both places, so the best and the worst of both.
Oh, that's good. So we want to talk about mental illness as we understand it in 2016 in America. And first of all, explain to us what this term encompasses. When you say mental illness, what are you really talking about?
Well, mental illness really is defined as a mental, behavioral, or emotional disorder, and actually doesn't include the substance use disorders, which most people think that it does. And so when you really talk about mental illness, you're talking about only a subset of the things that we oftentimes really refer to as all of the mental illnesses.
But when we say 1 in 5 Americans has a mental illness, does that include the ones who are abusing substances?
No, it doesn't. So that's even more. So it's really 1 in 3 Americans are affected by either mental illness or substance abuse. So that means that everyone in this country is affected by it. It's either yourself, one of your loved ones, or one of your friends.
1 in 3. How long have you got?
Recently, I've heard the phrase speaking about people's mental health instead of focusing on mental illness. Mm-hmm. So kind of talking about it in a different way. Is that something that's consciously being done, or am I just picking up on that?
Well, of course, that's a positive kind of a spin, and we all want to hope that we have good mental health. But I think that, unfortunately, the facts reveal that there are a number of people who have mental illness. And mental illness is no different than any other medical condition, which has been a real problem for those who have been stigmatized by having mental illness versus having a medical illness like a cardiovascular illness or diabetes.
Has this 1 in 3 or even 1 in 4 or 1 in 5 people who have mental illness or substance abuse, has that remained fairly steady over the decades, or are there a lot more mentally ill people today than there used to be?
Well, that's a very good question, and I'm not sure that we really know at this point. There was a huge epidemiological project that was done back in the 80s, which came up with the information back then that basically 1 in 5 with mental illness and 1 in 10 with a substance abuse, which means then 1 in 3 basically have a mental illness or a substance abuse. And I think, it's hard to know really what's going on. I think clearly the issues with substance use disorders has skyrocketed. Everyone's reading about it in the paper right now with the opioid epidemic that's going on, and there's a lot of synthetic agents that were not even present back in the 80s. So I would suspect that it's probably even more common than we really realize.
Why do you think that is?
Oh, I think it's multifactorial. I don't think there's just one cause for it. I think more and more is expected of people, faster and faster, and the stress levels are high, and people try to escape from some of it. I think that's a big part of what's going on with the substance use disorders. I think that there's, as I said before, it's multifactorial. I think, some of the government regulations that no patient should ever have pain, and that physicians were going to be measured on pain and then reimbursed on pain, has really contributed to the opioid epidemic.
So we've gone too far the other direction. So the physicians were criticized for a while because they weren't doing a good job controlling people's pain, and now we're giving out too much pain medication. Is that what you're suggesting?
That's the fact.
And what about depression, anxiety disorders, schizophrenia? Are those more common, or are they just being better diagnosed now?
I think it's mixed. I think that, probably the psychotic disorders are being, which would be schizophrenia, are probably being diagnosed better. But I think depressive disorders are mixed. I think maybe major depression and bipolar disorder that have real true biological underpinnings, there's no evidence to suggest that they're dramatically changing in prevalence. But stress disorders that produce milder depression, now that could be on the rise.
And what about, you just said the biological piece. Does the study of genetics right now at this time in medicine, is that contributing to some of that, figuring it out a little bit more often?
We wish.
Yeah.
It's not there yet.
How do we compare with the rest of the world in
That's
terms of mental illness?
That's a very good question. The statistics are that probably 1 in 8 people worldwide have a psychotic disorder, but there's the third world nations. There are no folks on the ground to really be able to measure the existence of certain mental illnesses. But there are some things that that the U.S. has unfortunately really taken over, and one of the big ones is opioid use. The opioids are used, 80% of the world's opioids are used in the United States.
Wow. So when you say psychotic or psychosis, you're referring to the most severe kind of mental illness, and you said 1 in 8 people worldwide. But what are the specific diseases that fit into that category of a psychosis?
Schizophrenia is one. Drug-induced psychosis can be another. What we call schizoaffective, which is kind of a combination between schizophrenia and depression, substances. So there's a whole range of disorders that can be part of the psychotic disorders.
And let's say depression's probably the most common, other than substance abuse, right? Of the mental illnesses, true?
Actually, anxiety is the most common.
Anxiety.
I was going to
okay.
say, it seems like anxiety disorders are the things that I hear
they
the
are.
most about.
And then
They are.
are those neuroses, or how do you tell the difference? What's the difference between a psychosis and a neurosis?
Well, that's
Boy.
the old terms. I'm not sure anybody uses the term neurosis anymore.
Well,
There,
see, I
Tom,
went to
but
medical school a long time ago, I guess. Well, you don't use those terms anymore.
not neurosis.
No, all
But
right.
the psychotic disorders are the ones where individuals have a real distortion of their thinking. Severe paranoia, delusional thinking. They can have perceptual distortions where they're hearing things, seeing things that other people aren't hearing and seeing. Those are the psychotic disorders. They oftentimes can happen with other neurologic problems or medical conditions, such as very, very severe Alzheimer's disease or dementing illnesses. People will then start developing psychotic problems, and that's why you see the numbers high worldwide, because they're oftentimes associated with medical conditions or other medications. Steroids can produce psychotic disorders. A lot of the substances that are abused can produce psychotic disorders.
And what is the anxiety disorders? Is that being more easily or more often diagnosed? Or why the increase in the anxiety disorder diagnoses?
I'm not sure that they've increased. They've just always been a high number. When they went back and did the big study that was NIH-sponsored back in the 70s and 80s, it was the number one mental illness, not substance abuse, but mental illness then. Generalized anxiety, panic disorder, post-traumatic stress disorder falls into that category, or did. Obsessive-compulsive disorder fell into that category. So there are a number of different disorders that fall into the anxiety disorder category.
All right, and one other comparison, Minnesota as compared to the rest of the country.
Well, that's a really good question, because that Minnesota, as progressive as the state is fallen way, way, way behind when it comes to really providing the type of care for the severely mentally ill
Really?
and substance abuse. Minnesota is 50 out of 50 states in the union for the number of psychiatric beds per capita. The typical type of numbers that people say could really be helpful to be able to meet the needs of the mentally ill is usually 50 beds per 100,000. Minnesota has 3.9 beds per 100,000. We are the worst state in the union. As a result of that, Tom, we have people sitting in our emergency rooms across the state, not for hours, not for days, not for weeks, but for months, just sitting in the emergency room waiting to be able to be transferred to a hospital where they can start getting ongoing care.
Well, that alone is pretty depressing. Where are all our tax dollars going? Can't figure it out.
That's a different show.
That's exactly right.
We're
That's
talking about
exactly right.
mental illness with psychiatrist Dr. Teresa Rummans. We'll take a short break, but when we come back, we've got a myth or matter of fact.
Most people born with depression never seek treatment. Is that a myth or a fact? You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We're talking about mental illness in America with Mayo Clinic psychiatrist Dr. Teresa Rummans. Dr. Rummans, myth or matter of fact?
Most people with depression never make it to treatment. They never seek treatment. Is that a myth or a fact?
Well, it's kind of complicated because those with mental illness, not just depression, only 40% of individuals who have a mental illness or a substance abuse will actually get care. So if you're going to broaden depression to include all of mental illness and substance abuse, then you're absolutely correct, because only 40% will really receive treatment.
How much is tipping the base here between quality of life and good mental health? Is there a tipping point in there, or is it one and the same?
I think it's relative. That's a hard question to really answer.
Well, the reason I think of it, I was raised that you just kind of don't talk about issues. You don't talk about problems. You just kind of buck up and move along. And in this day and age now, it seems that for better mental health, you'd say, no, if there's something that's bothering you, talk about it.
I would agree with that.
Mm-hmm.
So, they were wrong back there in South Dakota.
Yeah.
Huh?
Yeah,
And-
only in
and
South
everywhere.
Dakota.
Yeah, everywhere. I want to ask you, Terry, there has been a significant increase in life expectancy over the past few decades in the United States. Now, men and women on average are living to be about 79 years of age. But recently, the CDC said that there's actually been a decrease in life expectancy, and I think it was particularly true among white women. I want to know if opioid use, alcohol use, other mental issues have anything to do with this.
You're absolutely right. And the three main reasons that there's been a decrease in life expectancy in the U.S. in the last few years are related to three primary things. One is suicide, one is firearm deaths, and the other are motor vehicle deaths. Suicide is self-explanatory. That's associated with mental illnesses and substance use. The thing that I think people could be very surprised about is firearms. Because of the way the media produces a lot of hype around homicides, most people would think that most firearm deaths are related to homicides. Surprisingly, that is not the case. 2/3 of deaths by firearms are suicide. So that's another major mental health substance use disorder. And you can imagine, I know the statistics are trying to be accrued at the CDC, but they haven't been publicized yet. But if you look at the motor vehicle accidents that result in death, probably the majority of them are associated with somebody that's associated with that accident having been using some type of substance.
Although texting may overtake that substance.
You're
abuse pretty
absolutely correct in the future. But right now, and with this data that has the life expectancy decreasing, all three of the major causes for the decrease in life expectancy have some association with mental health or substance use disorders. Another interesting fact is just the health impact of mental illness and substance abuse. The 10 leading causes of death that are rising versus those that are decreasing, like cancer deaths are decreasing. But there are 10 conditions where the actual death rates are increasing, such as unintentional injury, COPD, strokes, Alzheimer's, drug overdoses, suicide, firearms, being septic or having a major infection, liver disease, and homicide. Of those 10 things, 8 of them, 80% of them are associated with mental illness or substance use disorders. So they are having a huge impact, worldwide. Even just the suicides alone have increased by 25% in the last 15 years.
Suicides
Have increased by 25% in the last 15 years.
You're talking about the financial impact of mental health, mental illness, and those things would fall into that category for sure.
No, absolutely. The cost for mental illnesses and substance abuse in the last 15 to 20 years have tripled. While all the other conditions, all the medical conditions that we're always talking about, whether it's cardiovascular, cancer, whatever else, have not even doubled. So you can just see that the impact that we're having, not just from an individual standpoint in life expectancy, but financial impact, and then so there's huge social impacts as well.
You were saying about texting, overtaking drugs or drinking during driving, overtaking. I think you could maybe make an argument that there is a mental health aspect in that some people can't, it's almost anxiety if they are kept away from their smartphone or their device, or they're not able to have that texting ability right there. Am I going out on a limb? What do you think about that? Care to comment?
I don't know much about whether that's true or not, but that'd be something that'd be interesting to look into.
The anxiety of the smartphone. If
That's it.
if it rings and you can't get to it right away.
Yeah, there's probably something to that. Unfortunately, we were born in an era where we didn't have to worry about
You have
that.
to
But
worry
it is
about
a
it. That's
huge
right.
problem, no question about it. Is mental illness age related? Does the fact that people are living longer have anything to do with the increasing incidence of mental illness? Is it more common as we age?
No, surprisingly, it's not. It's less common, unless you want to exclude, if we're excluding the neurocognitive disorders, the dementing illnesses. It's actually less common as you get older than it is in the youth. It's really the highest incidence is primarily in youth. And even when you just look at the suicide numbers overall, the suicide rates, it's the 10th leading cause of death in the U.S., period.
Suicide, 10th leading cause
Yep.
of death?
Right. But for those that are 10 to 24 years old, it's the third leading cause of death. It's the second leading cause of death for those that are 15 to 24. And then those are much older, it's less. So you can see it has a huge impact. Just suicide alone has a huge impact on our young people.
All right, we've got, a minute and 20 seconds remaining, so what do we do? What's
Well-
the answer to all this? It's sort of frightening.
It is frightening, but I think that there are really three things that can happen. One of them is what we're doing right now, and that's really trying to educate people about the facts. There's a lot of myths, as you guys brought up earlier, about what mental illness and substance abuse is, or are and are not. And so I think educating people about the actual facts is extremely important. Second is recognizing that it's a real problem. This is a real, genuine problem that is not going to go away and can't just be kind of pushed over into a corner. And then finally, acknowledging that we have to do something about it, and it's all of our responsibilities. It's not just the mental health provider's responsibility. It's just not law enforcement's responsibility or faith-based communities' responsibility. It's all of our responsibilities. And I think if we all work together, the government, healthcare, and community types of groups, we can make a difference.
It sounds like in the state of Minnesota, we need to write our congressmen and women about the problem of mental illness right here in Minnesota, that it sounds like it's not being very well taken care of.
Absolutely, especially when it involves really the needed placement hospital beds for those that are very ill. Because what's happened since the 1960s, when Kennedy, meaning well, wanted to close many of the state psychiatric hospitals and hoping that we would have community hospitals and community centers, which did not really develop. What's happened is that individuals who were being cared for in mental hospitals now are either being cared for in jails and prisons, or they're out on the streets and homeless.
Dr. Terry Rummans, Mental Illness in America, 2016. Thanks so much for being with us. Nice to see you.
Thank you for having me.
Still to come on Mayo Clinic Radio, we'll learn how to protect yourself when exercising in extreme heat.
You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.